Life before treatment with Ethan was really scary because with food allergies, you just never know when a reaction is going to occur.
For the Horn family, living with 2 children with food allergies has been difficult. And they've been living with it since their oldest son, Ethan, was just 2 years old.
He had an anaphylactic reaction to just some mixed nuts, and we had no idea. As we were driving him to the urgent care, he stopped breathing in our car.
Allergies have caused Ethan problems for years. And it wasn't just the physical reactions. The isolation was hard too.
He was, sitting at his own table for every single snack time, regardless if there was peanut butter involved or not. And the teacher would be afraid to give him certain snacks. And so he would come home and he would cry that he didn't want to go back to school.
According to foodallergy.org, 15 million Americans have a food allergy. That's 1 in every 13 children in the United States and 70,000 Utah children. Now, one Utah doctor is offering hope to thousands of kids.
We've seen outstanding results. So most of our patients that we've enrolled in this program have been able to, within 6 months, consume a food that was once life-threatening to them.
So how does the doctor do it? By feeding his patients the very foods that make them sick.
We start off with a very dilute, minute dose of whatever they're allergic to, and at a very deliberate, calculated schedule, we slowly increase that dose over time.
Jones says by increasing the dose over time, the body develops a natural tolerance to the food that caused the allergy.
Within 6 months, we can take somebody who would have a life-threatening reaction to either milk or eggs or peanut or wheat or soy. We can take them from a situation where that would be life-threatening to them to where now they can consume it without any kind of restrictions.
For Mom, the treatment was terrifying.
When you've seen your child stop breathing because they ate that peanut or they ate that cashew, giving it to them on purpose is very scary.
That fear now gives this family a little peace of mind.
We've always tried to keep his life as normal as possible, but now I feel like we can really do that for him.
Just like her brother, Emma is making progress. And that's exactly why Dr. Jones started this program.
Really, the patients is what make me passionate about this subject because they're so desperate. I mean, they struggle so much with having to avoid, and they live in fear and they have a lot of anxiety.
The program must be under the guidance of a doctor. Jones emphasizes the importance of not trying this on your own.
There is no way this should be done at home on your own. It could be extremely dangerous and be very detrimental. It could be life-threatening.
You're so desperate to be able to give your child a normal life. I never thought that there was going to be something like this, and I'm so grateful that there is.
Making life normal for kids. I'm Robin Seville, and that's good for Utah.